In this week's segment of What's Going Around, I asked local doctors what are the most common illnesses going around schools right now. Well, they said the common cold and respiratory viruses. But if you've been following the news last week, then you saw that whooping cough or pertussis is making a comeback right here in North Alabama. Now, this is very alarming because my daughter actually started coughing last week. I actually didn't know how to tell if she had whooping cough, so I asked a nurse practitioner what are the signs and symptoms to look out for. She said in the beginning you need to check for the regular common cold symptoms such as a runny nose, a fever, mild cough. That's typically what kids experience. However, as time progresses, those symptoms change. Those coughs become more distinctive. It actually starts to sound like a whooping sound. Take a listen. Well, fortunately, my daughter actually did not have it, but state health leaders and the Centers for Disease Control and Prevention, they're now warning more and more Alabamians are getting it. And it's pretty scary when you think about it because whooping cough is the most contagious during the first 2 weeks of developing it. However, some people who even get it don't have the cough. For instance, babies, they just have difficulty breathing. Doctors say it's really important to pay attention to the symptoms and seek medical attention immediately if you think something is off. Now, to treat it, researchers recommend antibiotics, they recommend rest and drinking a lot of fluids. And state health leaders urge every parent to get the Tdap booster vaccine to help protect their kids from the whooping cough. And if there is an issue you would like me to look into, just reach out to me on social media. For this week's What's Going Around with coverage you can count on, Demetria Green, WAAY 31 News.